Hi guys, you're back here with Nurse Natalie. Here's my nursing badge just to double check that I'm actually a nurse. Today we are going to go into Mr. Smith's room and I'm going to show you how to don and doff your gloves. So first off, we're going to do a room tour and a room scan. I'm going to show you what the outside of a patient's room looks like versus the inside and all whatnot. Over here is our station where we have our different hand sanitizers. We just have shelves. Right here is the patient's room. Here's the patient's bed, the patient's over there, and whatnot. So let's get started. Okay, first of all, our patient has influenza. That is a contact and a droplet infection. So we're wearing full PPE. But before we get that on, we have to sanitize. So I'm going to use hand sanitizer. It's truly up to you guys if you want to wash your hands or if you want to use sanitizer. If your hands are clean, like no soiling, then hand sanitizer is the easiest. But if there is soiling, wash your hands because that will bring a disease. So I have a hand sanitizer. I'm just going to wash it in. I'm going to make sure that it is not going to be wet. So we're making sure we're rubbing until it is dry. Don't do this. Nope. We're going to make sure it's dry. Okay, my hands are dry. Next, we're moving on to our gown. So I have my gown here. It is yellow. You're going to make sure that it is on properly. So the arms are going to be in front of you. The open back is there. So you put your arms through. You want to make sure it's up to your shoulders. You have some strings here and here for you to tie. I'm going to tie them behind my neck. You guys can decide if you want to tie them on your front first or behind your back. Personally, I like behind my back because I know it's going to be secure and I know it's tight. Oh, wait, I missed. Give me 1 second. There we go. So it's tight. Next, you have your front strings. So you want to make sure your back is covered and secure. And you can decide either on your front or your back. Today, I'm going to make sure I'm tying it on my front because that's easier for me. So nice and tight. Nice and tight. I don't want to break it. So not too tight that you break it, just in between. There we go. Okay, next we're going to put on our mask. So we're running short on N95, so we're just going to use regular masks. So make sure it's behind your ears, under your chin. It's nice and tight, pinch around the nose. Next is our glasses or goggles. These can be provided by your facility. You're going to put them on. And next is our gloves. So you want gloves that fit your hands very well. You want kind of tight, in between tight and loose. You don't want very loose. Because what we're going to do is make sure our sleeves are in our gloves. So you got to make sure that you put some of your sleeve on your palm. You're going to get ready. And you're going to pull your hand through. Just like this. My gloves right now are a bit loose, so it's a bad example. But typically you want as tight as you can get. So hands in, hands in. The tighter the better. You don't want to get exposed. There you go. Okay, we're going to enter the patient's room. So I'm going to knock on the door. Knock, knock, knock. Open the door. Good morning, Mr. Smith. How are you today? I'm going to put the camera right here so you guys can see it all. Good morning, Mr. Smith. How are you today? You're good? That's good. My name's Natalie. I'm going to be your student nurse today. I'm first year student, and I'm just going to take your vitals. Is that okay? Amazing. Okay. Do what you got to do. Okay. Thank you so much for your time, Mr. Smith. I'm just going to lower down your bed so you don't fall or anything happens, and it's easier to get it outside. Is that okay? Perfect. So if it's a button, push it. If it's your foot, which it is, you're going to wait till it lowers, 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 lowers. Okay, great, Mr. Smith. I'm just going to make sure your bed is locked. So checking the sides, you can do this by pushing or just double checking the locks. Double checking the locks. Double checking the locks. I can't reach the other side, but we're going to imagine that I locked the side. And next, we're going to put up our guardrail. So I'm just going to put your guardrail up, Mr. Smith. Is that okay? Perfect. So pulling it up, putting on. Imagine for the other side. Okay, Mr. Smith, thank you so much for your time. I'm putting your call bell light here. If you need it, press it, let us know, and we'll come help you, okay? You good? Okay, have a good rest of your day. Okay, let's head out of the patient's room. Okay, we're done with our patient. Now we need to get our PPE off. So, because Mr. Smith has influenza, we have to be careful because we do not want to get exposed. So, you're going to take from the palm here for your glove and pull it out. And then you're going to go from the inside here. And you're going to pull until it's out. And then typically you get the glove in the middle. you're going to throw it out. So I'm throwing it out in my garbage. Next, you're going to take off your gown. So undoing it. Oh, it's a knot. You can rip it. It's up to you guys. It is just a knot right now. Undoing it. Yeah, it's a knot. Okay. I got my top off. Now I'm going to undo the front. There we go. And you want to shimmy it off. Shimmy it off. Or you can put your hand inside. Make sure it's the inside. Pull it off. Inside, pull it up. And you want to make sure the insides are getting in the middle here. And you're going to throw it out. Next, important part. Sanitize. Please sanitize. You just touched a dirty gown, or, well, technically you're not supposed to, but if you did touch it, you want to make sure that you were sanitizing. You do not want to get that sickness. That is gross. So making sure we're sanitized and we are using all safety precautions we can. Okay, my hands are dry. Next, I'm going to take off my mask, throw it out, and now I'm going to take off my goggles. So depending on what your facility says, you can put them in the box that returns them, or if they are throw out, just throw them out. So I'm going to leave them over in the bin. And finally, we are done, but we're not done yet. I might look done, but I'm not. You are going to go hand sanitize again or wash your hands. Me personally, I'm going to go wash my hands because I just don't want to run the risk of getting infected, and I'm already hand sanitized a lot. So I'm going to turn on my water. I'm going to wash my hands for 20 to 30 seconds. Make sure I'm getting my cuticles, making sure I'm getting the nail beds. That's where a lot of bacteria resides. Washing in between the fingers, hard to reach areas. Getting to my wrists because sometimes my wrists do get exposed. So scrubbing, rinsing, and you want to dry nice and making sure you throw the garbage out. There you go. So use these tips and try and do your own dotting and doffing at home. Have fun, guys. Let me know if you have any questions.